and a very good morning. I, Dr. Ghazala Javed, on behalf of CCRUM Ministry of Ayush, welcome everyone to the two-day virtual training program, especially designed for community health officers under Unani stream. I take this opportunity to welcome and convey our token of respect to respected Joint Secretary Shri D. Senthil Pandiyan sir, for sparing time from his busy schedule and gracing the occasion for inaugurating the training program. I also welcome our respected Director General CCRUM, Professor Asim Ali Khan Sahib, and Advisor Unani, Dr. M.A Qasmi Sahib. I welcome all the registered delegates also. Friends, the Ministry of Ayush has the mandate to promote and propagate Ayush systems of medicine at grassroots level. Operationalization of Ayush Health and Wellness Centers under Ayushman Bharat is a progressive step in this direction. The objectives of AHWCs are to provide comprehensive primary health care through Ayush using team-based approach, establish a holistic wellness model based on Ayush principles and practices, focusing on preventive, promotive, curative, and rehabilitative healthcare by establishing integration with existing public healthcare system, and provide informed choice to the needy public by making Ayush services available. I'm happy to inform that in this training program, we have representation from state of Bihar, Haryana, Union Territory of Jammu and Kashmir, Karnataka, Punjab, Rajasthan, Tamil Nadu, Telangana, and Uttar Pradesh. I again extend our heartfelt welcome to the registered community health officers. As we are aware, this training program is basically a reorientation program for the Unani professionals working as community health officers. To begin with, I will invite Professor Asim Ali Khan Sahib for his introductory remarks. Sir is the Director General of Central Council for Research in Unani Medicine.
Very good morning to all. Assalamu alaikum. Shri D. Senthil Pandiyan Sahib, Ministry of Ayush, Government of India. My colleague Dr. M.A Qasmi Sahib, the Advisor, Unani Ministry of Ayush. The online registered community health officers, speakers, and coordinators, ladies and gentlemen. Indeed, it gives me immense pleasure to welcome you all to the two-day refresher training for community health officers of Unani stream, being organized by CCRUM under the guidance of Ministry of Ayush on these 2 days, that is 7th and 8th June of this year. Ayush Health and Wellness Centers are being operationalized by the Ministry of Ayush under Ayushman Bharat scheme through state and union territories, governments within centrally sponsored scheme of National Ayush Mission with National Health Mission. These Ayush Health and Wellness Centers are being created by upgrading existing Ayush dispensaries and sub-health centers. The objectives of setting up these AHWCs, we call them, is to provide comprehensive primary healthcare services to the community as per their informed choice, with focus on prevention of diseases and promotion of good health and wellness. These health and wellness centers would function on the principles of Ayush systems, providing a holistic approach. Each of the health and wellness center will be headed by a community health officer who will be entrusted with the responsibility of a team leader for that center. The orientation guidelines for these community health officers of Unani medicine are prepared by the Central Council of Research in Unani Medicine. It provides basically a preventive and management framework for healthy practices that can be instrumental in preventing and controlling the diseases. These guidelines focus more on early interventions based on Unani principles and practices. And these guidelines can be utilized for capacity building of the CHOs and suitably equip them for achieving the desired objectives of these health and wellness centers. As another step in the capacity building of the CHOs, we are organizing this refresher training program, which will have lectures on the 12 service delivery areas designed for Ayush Health and Wellness Centers. And the program is also designed to refresh the skills of our CHOs and enable them to provide comprehensive primary healthcare services to the community. I'm happy to state that around 380, 390 CHOs from the state of Bihar, Haryana, Union Territories of Jammu and Kashmir, Karnataka, Punjab, Rajasthan, Tamil Nadu, Telangana, and Uttar Pradesh, and are participating in the training program. Friends, I'm confident that the Ayush Health and Wellness Centers would not only benefit the masses, but would also help in further integration of Unani medicine into the mainstream healthcare of the country. I take this opportunity to highlight the efforts of Government of India in developing Unani medicine. The Government of India initiated a series of measures by providing increasing patronage and funds for multifaceted developments of Unani medicine, as well as other Indian systems of medicine. And these are basically to cater the primary healthcare needs of our countrymen and our fellow nationals. As a result, the Unani medicine today, we can say that it forms an integral part of the national healthcare delivery system. And we can proudly also say that today India, with all this huge infrastructure and the government support systems and government's funding and increasing patronage, we can proudly say that India is a world leader in Unani medicine. As far as the Central Council of Research in Unani Medicine is concerned, it's basically an apex body for formulation, coordination, development, and promotion of research on scientific lines in Unani medicine for over the past 4 decades of its existence. The Council, through its various research programs, has obtained significant leads in areas of clinical research, drug standardization, survey and cultivation of medicinal plants, and literary research, which has attracted international attention. CCRUM, having good infrastructure and expertise in Unani medicine, is spread across its almost 29 peripheral institutions pan-India, has established linkages with academic and scientific institutions of repute to work together and leverage their facilities and expertise for the advancement of traditional knowledge in scientific language and furtherance of other objectives of the Council. And for this purpose, the Council has also entered into a lot of collaborations and agreements with various reputed institutions within the country, like NIPER in Hyderabad, Remiti University, Hamdard University, Vallabhbhai Patel institutions, and AIMS in New Delhi, as well as CSIR and Jawaharlal Medical College, Aligarh, and certain international institutions also. Under the co-location center scheme, we also have established in tertiary care hospitals certain centers like in Ramanoloya Hospital, Deen Dayal Upadhyaya Hospital, Safarjung Hospital, and JJ Hospital in Mumbai. So many such things. We also have a house in as a integration center in Ayush Health and Wellness Center in Rashtrapati Bhavan, as well as in All Institute of Ayurveda. Under one roof, we all work together as an integration. CCRUM has also started accreditation of some of its institutions by National Accreditation Board for Hospitals and Healthcare Providers, who calls NABH. And the Hyderabad institutions and the Srinagar institutions have already obtained the accreditations in recent times. I'm also happy to inform you that the Ministry of Ayush is establishing the satellite campus of NAM, that is National Institute of Unani Medicine, Bangalore, Ghaziabad, with approximate cost of more than 300 crores on 10 acres of land. This is a 200-bedded hospital facility. The Ministry of Ayush has also provided the financial assistance of almost rupees 17 crore out of the estimate cost of rupees 32 crore for the establishment of the Unani Medical College and Hospital in Kashmir under centrally sponsored scheme to start the BUMS course in the first ever government Unani Medical College and Hospital Jammu and Kashmir at Nawab Bagh of Gandhinagar district. The Ayush Center of Excellence scheme for the Ministry of Ayush also recognizes the organizations having demonstrated the excellence in Ayush sector, and under the scheme, certain reputed Ayush institutions are supported for upgrading their facilities to the level of excellence. Recently, one of our institution, peripheral institution, that is in Srinagar, has been awarded a project amounting to 7 crore plus under the scheme for upgradation of facilities in regional therapy, that is Rajput Tadbir. The Ministry of Ayush has also sanctioned 10 crore for 3 years for establishing a center of excellence in Unani medicine at Jamia Hamdard for carrying out advanced research. I will not take much time. I was supposed to speak much, but a lot of meetings are lined up for our Joint Secretary Sahib also has to move. So I'll not be taking much time. So I would be concluding. I had many things to speak, but I have maybe I have to conclude. In fact, we have to be strong at our primary healthcare level. The futuristic initiative of the Government of India for achieving holistic health and wellness through health and wellness centers would, in my opinion, and I'm confident for that, is going to go a long way, and it's continuous and dynamic process which requires consistent efforts to keep it vibrant and live. I do believe that the integration of Ayush, including Unani medicine, would further strengthen the preventive and promotive health needs of our society for achieving the national goals for health and wellness for all. And I'm happy to see that we have a strong team of our clinical health officers in Unani stream who are participating in this two-day training program. I'm very sure that this training program is going to help for all our community health officers, and I wish them every success. And I hope and I wish and I'm confident that these community health and officers, health and wellness officers, they will be serving the society, our nation. And with this understanding, I hope that in the coming years, not very far, that they will be inculcating the sense of discipline in the minds and the lifestyle of our own people, so that our society will be healthy, and we will also having a reduced burden of economy on our economy of diseases and disorders. With these words and good wishes, I thank you all, and thanks for Dr. Ghazala and other organizing members of our team for providing this opportunity. Thank you very much, and Jai Hind.
Thank you, sir. Thank you very much. Now I feel privileged to invite respected Joint Secretary Shri D. Senthil Pandiyan Sahib. Sir is an IAS officer from Uttarakhand cadre. Sir has done his graduation in agriculture from Tamil Nadu Agricultural University and Masters in International Development Policy from Sanford School of Public Policy, Duke University, North Carolina. Sir has worked in some important positions like Secretary, School Education, Transport, Agriculture, Medical Education, Rural Works Department, Cane Development and Sugar and Panchayati Raj. He has been Chief Project Director of Integrated Livelihood Support Project sponsored by IFAD, Divisional Commissioner Kumaon, District Magistrate Haridwar, Dehradun, Uttam Singh Nagar, Pauri Gohal, Pithogra and Rudraprayag. And he has been Mission Director of National Health Mission, Vice Chairman, Masuri Dehradun Development Authority, State Project Director, Sarva Shiksha Abhiyan, Rashtriya Madhyamik Shiksha Abhiyan. Sir, it is an honor to have you with us. I invite you for your inaugural remarks.
First of all, Professor Asim Ali Khan ji, DG CCRUM, Dr. Qasmi ji, Advisor Unani, Dr. Suresh, Deputy Advisor looking after National Ayush Mission, Dr. Amit, looking after Health and Wellness Centers, distinguished speakers, coordinators, and my dear community health officers. Good afternoon to you all. First of all, I would like to welcome you all for this two-day training program on the Unani stream of medicine in the health and wellness centers. You are all aware the disease burden is rapidly shifting towards non-communicable diseases in India. Ayush systems can play an important role in addressing the issue with main focus on prevention and promotion of good health and wellness. I think during a pandemic also, many of our the public online through Sanjeevani portal, more than 89% of the public, they have accepted the Ayush way of treatment based upon our record. We have the data also. And Ayushman Bharat, a flagship scheme of Government of India, was launched as recommended by the National Health Policy to achieve the vision of universal health coverage. This initiative has been designed to meet sustainable development goals and its underlying commitment, which is to leave no one behind. Ayush Health and Wellness Centers under Ayushman Bharat scheme envisage to deliver expanded range of comprehensive primary healthcare services to people. We are going to establish 12,500 Ayush Health and Wellness Centers across the country by the year 2023-24. Already we have approved more than 7,000 health and wellness centers. Almost we are touching 4,000 health and wellness centers, which is progressively functional. In the coming years, we are going to functional around 12,500 health and wellness centers. This will enable demonstration of the effectiveness of Ayush-based health and wellness model in the strengthening of comprehensive primary healthcare with primary focus on preventive and promotive interventions. It will also help in reducing disease burden and out-of-pocket expenditure by educating the masses and providing informed choices. You are all aware that the Ayush system of medicine comprising of Ayurveda, Yoga and Naturopathy, Unani, Siddha, Suva, Ripa and Homeopathy are a comprehensive scientific system of medicines which are extensively practiced in India. India's cultural diversity has ensured that all these systems of medicine are recognized in India. The Ayush system of medicine provides solutions for numerous health problems faced by the public, like joint pains, rheumatism, sinusitis, diabetes, or bronchial asthma, etc. I believe that Unani medicine can play an important role in improving the health status of the masses with its cost-effective remedies for all segments of population. The government of India has always paid a special attention to the development of indigenous system of medicine in India. It has been providing increasing funds and support for multifaceted development of Ayush systems, including Unani medicine. I am happy to note that today India has the widest network of educational, research, healthcare and pharmaceutical institutions of Unani medicine and enjoys the position of a world leader in this area. The Unani medicine, which is one of the recognized systems of traditional medicine, has been developed scientifically, nurtured and systematically integrated in the healthcare delivery system over the years. Research and development in Unani medicine is by and large in the hands of Central Council for Research in Unani Medicine, which is doing commendable job. It has a vision to strive for excellence and global leadership in the field of Unani medicine by comprehensive research for quality assured and cost effective products to prevent, manage and cure various diseases. The 2 day training program is being organized for community health officers under Unani stream, which will have lectures on the 12 service delivery areas designed for Ayush Health and Wellness Centers being operationalized by Ministry of Ayush. The aim of the training is to refresh the skills of community health officers and enable them to provide comprehensive healthcare services to community with the focus on prevention of diseases and promotion of health practices in the community. Unani medicine is a science of health and healing which lays great emphasis on promotion and prevention of health and prevention of disease. Ministry has already published orientation guidelines for community health officers under Unani stream and have been shared with all community health service officers. These orientation guidelines for community health officers of Unani medicine prepared by the Central Council for Research in Unani medicine provide preventive and management framework for healthy practices that can be instrumental in preventing and controlling diseases. These guidelines focus more on early interventions based on Unani principles and practices. These are comprehensive guidelines. However, with evolving time, the guidelines would be further upgraded as per the need of community and experience gained during implementation. It is expected that the coordination between State Health Department and State Ayush Department would ensure delivery of holistic health by operationalizing yoga, appropriate use of Unani medicines, healthy routine practices, and Ayush medicine choices at the community level under National Health Mission. I congratulate the entire team, including Professor Asim Ali Khan and his team of officers. And also, I would like to congratulate our NAM, National Ayush Mission team, under the leadership of Dr. Suresh and Dr. Amit, and also all the experts involved in the preparation of the guidelines. I would like to once again thank all the participants also. I look forward the participants they will have to participate in the discussions and they will have to enrich their experience in the health and wellness center sector. So I take immense pleasure in inaugurating this training program. Once again, thank you all. Jai Hind. Thank you.
Thank you, sir, for your inspiring inaugural remarks. And it is an honor to have you with us. And it is highly encouraging for us, and I'm sure for all community health officers who have joined us as registered delegates. Thank you so much, sir. And for formal vote of thanks, we have with us Dr. M.A Qasmi, who is working as an advisor Unani in Ministry of Ayush.
Shri Senthil Pandiyan, Joint Secretary, Ministry of Ayush. Professor Asim Ali Khan Sahab, Director General, CCRUM. Community Health Officer from different states. Officers from the Ministry of Ayush and CCRUM. Ladies and gentlemen, it is a great privilege for me to propose the vote of thanks in the launch of 2 days training program for community health officers of Unani system being organized by CCRUM Ministry of Ayush on 7th 8th June. I express my sincere thanks to Shri D. Senthil Pandiyan ji, Joint Secretary Ministry of Ayush, who is wholeheartedly working for establishment of Ayush Health and Wellness Center through the country. Ayush Health and Wellness Center under the Ayushman Bharat scheme envisages to deliver expanded range of comprehensive primary health care services to people. Total 12,500 AHWCs have to be upgraded in phased manner by the year 2023-24. This will enable demonstration of the effectiveness of the Ayush-based wellness model in the strengthening of the comprehensive primary health care with primary focus on the preventive and the promotive interventions. It will also help in reducing diseases burden and out-of-pocket expenditure by educating the masses and providing informed choices. Unani medicine, with its health promotive and disease preventive measures, can play important role in primary health care. I express my heartfelt gratitude to Professor Asim Ali Khan Sahib, Director General CCRUM, for organizing the training program for the community health officers of Unani stream who are working at the Ayush Health and Wellness Centers. I highly appreciate this initiative as it is important to organize such training program which would help in refreshing the skills and competencies in the Unani physicians and would eventually help in realizing the objectives of the Ayushman Bharat scheme. I am thankful to Dr. Suresh Kumar, Deputy Advisor, Ministry of Ayush, and Dr. Amit Bhatt, RO Ayurveda, and other officers from the Ministry of Ayush who are actively involved in coordinating all activities related to Ayush Health and Wellness Centers. I also thanks the officer of CCRUM, especially Dr. Ghazala Javed, ROU research scientist for and her team who had prepared the orientation guidelines for the community health officer under the Unani stream and are now coordinating the training program for CHO under the dynamic leadership and guidance of DGCCRUM. I express my gratitude to all the CHOs for their enthusiastic participation in the training program. Thank you, Jai Hind.
Thank you, sir. Thank you for those vote of thanks, highly encouraging for us. So once again, thanking respected Joint Secretary Sir Shri D. Senthil Pandiyan for inaugurating the training program, respected Director General Professor Asim Ali Khan, and respected Advisor Unani Dr. M.A Qasmi Sahib for joining us. Thanks a lot.